Thank you for your, I know, round-the-clock work on this. We are so very grateful for a lifetime of work and care in this avenue. But I want to speak about the issue of access and capacity and how we can use telehealth in our evaluations to potentiate our response, because many of our constituents are worried about the spread of coronavirus. They have questions about their own health, and since the symptoms of coronavirus can present like a cold or the flu, I can only imagine with what people are seeing in the news that they're going to seek out care. People are a little nervous, needless to say. And so in Nevada, we have large areas of rural population far away from city centers, and an increase in those seeking care and having to travel is not only hard on them, but creates a burden on the system. So depending how, of course, how easily this virus spreads. How can we use telehealth as a first response to help people in their own homes? This could contain the virus, relieve a burden on our emergency rooms. So what are your recommendations? I have a two-part question on addressing the barriers to accessing telehealth. And do you have any plans potentially to operate a national hotline or a web portal for initial screenings through some kind of telehealth hub, and then people could be referred to their local care or further out if needed? Please.
Yeah, we've made a lot of progress since the 2009 pandemic, where this was a huge issue. Just getting a nurse triage line developed in one state. We had more lawyers than we had health people trying to figure out how to do that. But most of the health plans have actually worked out some of these kinks, and we've already been contacted by a number that are adapting their nurse triage lines, the hotlines that you talk about, really for their state or for their clinically covered individuals. We also have been working with telehealth together with other parts of government to try to understand what kind of approaches are appropriate in the rural areas, as well as what the coverage will be. And that's one of the things that the CMS is looking at now.
Ma'am, one thing that we've been doing for the last 2 years, we funded 2 pilot programs called the Regional Disaster Health Response System, one in Mass General and one at University of Nebraska. And in Nebraska, particularly looking at the nuances of how we could use telehealth to expand outreach to not only Nebraska, but to other parts of the region in that way, and evaluating whether both the legal and practical limitations to that.
And can I ask a question about telehealth? Because this would have to do with insurance and telehealth, considering that this could be a global pandemic, or we have other issues, regional issues, rural issues. I wouldn't want insurance to be a barrier for someone being able to at least access a telehealth hub or get the care, because germs do not care whether you're insured or not, Democrat, Republican, old or young, et cetera, et cetera. So how do we address this issue of people feeling like they couldn't call or use this because of insurance limitations?
Yeah, I can just say the strategy that we're thinking through at CDC is really trying to identify the right level of care for the right situation, whether it's telehealth, urgent care, nurse hotline, or emergency room or office. And in the circumstances that we could see, keeping people out of the healthcare system physically could be in everybody's interest, to preserve it for those who need it most. The insurance issues in a pandemic would probably be somewhat different than in routine times. It looks like Dr. Cadillac wants to say something there.
No, I would just like to add, in declared disasters, Stafford Act, we have the opportunity to declare individuals as NDMS patients, National Disaster Medical System patients, where they get reimbursed, or the provider gets reimbursed to 110% of Medicare rates. And there would be an interesting way to look at how you could evaluate it in a pandemic or something of this sort to use that. And we're in initial conversations with CMS to understand if that could be utilized in this way.
This could be really impactful, negatively or positively, if we don't address this in the right way. So understanding that, what additional resources or what should we be looking at as we're going to be voting on some funding and resources, hopefully this week, next week, that you would need to address this issue?